Our first obligation, and I want to talk about, is to protect the most vulnerable New Yorkers. Hospital patients, those in nursing homes and homes for aged, and also New Yorkers who, because of age or infirmity, are homebound. Earlier today, I mentioned the low-lying areas of our city that are most at risk for flooding and other damage from a hurricane and have been designated as Zone A low-lying areas in our coastal storm plan. These Zone A low-lying areas include Coney Island and Manhattan Beach in Brooklyn, Far Rockaway and Broad Channel in Queens, South Beach, Midland Beach, and other low-lying areas on Staten Island, and Battery Park City in Manhattan. Included in these Zone A low-lying areas, there are 5 hospitals. These hospitals are now in the process of reducing their patient caseload in order to be ready for any increased emergency care that might arise. They are, for example, canceling and rescheduling elective surgeries. In addition, tonight, Coney Island Hospital will, under the direction of state health authorities, begin placing patients in vacant beds in other hospitals in other parts of the city. We're also notifying the other hospitals in these Zone A low-lying areas, as well as nursing homes and senior centers in these low-lying Zone A areas, that they must, I repeat the word must, evacuate beginning tomorrow and complete the process by 8 p.m. tomorrow night. What we're trying to do is to take precautions for the most vulnerable. And as we get closer to the actual arrival of the hurricane, for the general public, we can decide what is appropriate. However, among the general public living at home, there are homebound people living in all of these Zone A low-lying areas. If you have a homebound relative or acquaintance in these low-lying areas, I strongly urge you to take some steps now to move them to a safer location, in your own home or in the home of another relative or friend. That will be the best course of action for all involved, and we're confident that in most cases that is what people will do.